Shooter needs to reach in and unlock a door. That's all they're looking for.
People are nervous around interacting with officers.
Sometimes there is help, but people make you have to jump through hoops to get it.
Hey everybody, I'm Lewis Fold, and what does self-care mean to you? It's a term that's used a lot these days. And for most people it means doing things that simply make you happy or improve your health. I try to make it to the gym several times a week and I always feel better afterwards. We need self-care to protect our own well-being, especially when life gets stressful. Sleep, one of those things that can fall to the bottom of our list of priorities, even though experts say lack of sleep can damage both our mental and physical health. That's why the Solutionaries team explored one way to add slumber to your self-care.
It's a little after 4 in the afternoon. My day starts around 3:30 in the morning when I get up. And so all I want to do is just get into cozy clothes. It's a little bit before 7 p.m. So the tricky thing is trying to get enough sleep before then. It's already a little bit after 8 in the evening, and I'm hoping my mind doesn't go racing different directions as I lay my head down on my pillow, but we'll see how it goes. All right, I got about 5 hours of inconsistent sleep, and I'm already hearing that it's going to be a busy morning, so I have to head down to the station, but not feeling super awake just yet.
Now, a lot of us are always on the go, but experts are reminding us to slow down and remember to breathe.
Inhale for 4. Hold for 7 if you can. And then exhale for 8.
Balance.
Lengthen up, push up.
Serenity
Hold for
and movement.
Cross completely over.
For Stacey Orsog, it's a daily ritual, and it's also a priority.
I practice what I teach, what I preach, so that I can be an example. And it's hard. It's hard, and I don't always want to do it. But if I don't do it, I'm not giving the best of myself, and I'm not honoring my body.
And what she practices, yoga, and it's mindful movement. One of the perks of practicing yoga, better sleep. And in order to get the best rest, it begins with stretching, a concentration on breathing, and awareness in your body.
You can close your eyes, and I want you to soften the spot between your eyebrows. And then soften through the eyes. Allow your eyes to sink into the sockets. Soften through your cheeks and your jaw, and peel your tongue away from the roof of your mouth.
So there are a lot of potential underlying causes for sleep deprivation. It can be anything from underlying medical issues like people dealing with chronic pain, mood disorders like anxiety or depression. Sometimes medications can contribute to insomnia or sleep deprivation.
When the lack of sleep is so serious, it begins to interfere with our daily lives. Vodder says it's time to seek medical help. However, she believes yoga can be beneficial to most who suffer from lack of sleep.
A lot of times when people are lying in bed awake and their mind is just racing and they're starting to get that anxious feeling, that just stimulates your mind and your body further. And the more stimulated you become, the more difficult it is to fall asleep. So if you can come up with ways to relax both your body and your mind, you're setting the perfect stage for good rest.
Although there are many benefits to yoga and mindful movement, experts say the biggest challenge, making the time.
That's pretty relaxing. I mean, especially for somebody that works very early in the morning.
But Orsog says it's about breaking our own barriers.
You have everything you need inside of you, starting with your breath, right? And the second thing is to listen to your body. It's just to become so in tune with your body that you recognize warning signals.
Let's be real. Relaxation looks differently for different people. Maybe for you, it helps to watch TV or a soothing video before bed. In fact, one of the most popular searches on YouTube is a certain type of video called ASMR, and the science behind the trend may surprise you.
Hey bestie, can I paint your face?
There are quite a lot of people who experience ASMR and they just think everybody does.
What?
I just get very relaxed and I get like tingles, kind of like a
Smile.
euphoric in a way, but I would just compare it to like a really good brain massage.
It's kind of like getting a head massage with one of those head massager thingies without being touched. So it kind of feels a little bit like that. It stands for Autonomous Sensory Meridian Response. The term describes a feeling. The feeling itself has been described as a kind of fizzing under the scalp and the, under the skin of the head, and like kind of goes down the body, and it's very relaxing and euphoric at the same time. It also feels a little bit like goosebumps if you've ever had that, but not really. You need somebody to be skeptical to drive you forward, to be like, okay, what would it take to convince you that this is a real thing?
Oh, what the heck? Let's get a little crazy and mix some of the yellow in.
And I joined TikTok during the pandemic while working from home and was very bored and lonely. I was scrolling on TikTok and some ASMR videos popped up, and initially I was a little taken back by the effect of it. There were a couple that I actually really enjoyed, secretly didn't tell anyone that I was watching these videos, like it was some sort of taboo thing. And then I started making it because the kind of ASMR that I wanted to see on TikTok was only really on, there wasn't as much of it on TikTok at the time, it was more on YouTube. Then it just kind of unexpectedly gained way more traction than I had anticipated. So.
One of the things that I think is really interesting from the data that we've had from the physiology of ASMR is the stuff that points to the fact that it's a very complex emotional state. So it's not simply it's just a pleasant feeling. It's much more complicated than that. So it's relaxing, but it's also activating. And so I would class it along with some other kind of aesthetic type experiences that involve a blending of different emotional states. So things like nostalgia, but also like weird things like being oddly satisfied or disgustingly satisfied, like this kind of complexity of emotion, like enjoying negative experiences and stuff like that. So I class ASMR in the realm of those kind of emotionally complex experiences.
I certainly think it helps me regulate myself a little better. It's a good coping action, like a good coping activity.
Most of those benefits are anecdotal at this stage. So you only have to like ask people whether they find ASMR helpful, and they'll be like, yeah, it definitely does. So which is great. And there's like, if it works for you, great.
Sometimes it can get even a bit meditative.
Relax your entire body, starting with...
It is really helpful emotionally in very low times. And even just to help with sleep can help with so many like associated issues with not having sleep.
It's not necessarily the case that ASMR will help everybody for everything, and we don't know how it works. So we don't know whether it does actually, like a lot of people say they use it for sleep, but what effect is it having on people's sleep? Like we need to measure that, and we need to actually look at what effects these things are having, because it could be that they're not having broad effects, or that they are helping with some aspects of sleep but not others, so we need to really do the research on it.
My ASMR icks, triggers that I don't like to watch.
There are some types of ASMR that I still find very repulsive and I cannot watch, and it gives me ick feelings. I wouldn't yuck anyone else's yum. So as long as it's not hurting anyone, I mean, and you don't understand it, there's a lot of things I don't understand, but I just allow people to continue to do them if it brings them joy. So.
Sweet dreams. Thank you, Paige.
Still ahead on Solutionaries.
When individuals go and meet with their doctor will say, okay, eat better. But oftentimes, as physicians, we're not trained on how you need to eat better for your particular condition.
Using food as medicine. More solutions for self-care next. Welcome back to Solutionaries. I'm Louis Bolden, and on today's show, we're talking about self-care. I'm here at the gym because this is what makes me feel good. That's what self-care is all about. Before the break, we talked about sleep and how yoga is one effective solution for getting better rest.
A lot of times when people are lying in bed awake and their mind is just racing and they're starting to get that anxious feeling, that just stimulates your mind and your body further. And the more stimulated you become, the more difficult it is to fall asleep.
On the flip side, millions have discovered self-care in the form of watching ASMR videos.
The term describes a feeling. The feeling itself has been described as a kind of fizzing under the scalp and under the skin of the head, and like kind of goes down the body, and it's very relaxing and euphoric at the same time.
Sleep, exercise, and relaxation are all extremely important to our health and happiness, and so is food. After a stressful day, treating yourself to a sweet or salty snack may seem like self-care, but experts say what your brain really needs is nutrition. Our Solutionaries team explored the concept of food as medicine.
You've probably seen this quote before: "Let food be thy medicine, and medicine be thy food." And that quote is most often attributed to this guy, Hippocrates, widely known as the father of medicine, and he said it way back in 400 BC. Except he didn't. Scholars have looked, and it isn't anywhere in his writings. The first mention of it was in 1926 in a fad diet book from one of the first health gurus in Los Angeles. But just because it doesn't come from the best place doesn't mean it isn't true. Across the U.S., more than 11 million people are considered food insecure by the USDA. But there's another problem. It's what's known as nutrition insecurity. And that's most easily shown like this.
I thought the best way to show this was through Venn diagrams on a whiteboard, because nutrition insecurity is more than just not having enough to eat. It actually breaks down into three things. The first is pretty simple. Is there enough food for you to eat? And is it near you? Usually within a half a mile is best. If you can get there, is that food healthy? A big problem in a lot of cities all across the country. And last is access. Can you get to that food, if at all? A lot of times people don't have cars, and the public transit is bad. Also, access is cost. Some of that food can be very expensive. And in all of these places where this overlaps, you find another problem. Healthcare costs also on the rise, often because people have to spend money to get healthcare, and they have healthcare needs because they haven't been getting the food that they need.
In 2022, the Michigan Food Security Council found healthcare costs from food and nutrition insecurity were more than $1.8 billion every year. And most of those are chronic health problems like diabetes, heart disease, and hypertension. It creates this sort of loop. People can't get the healthy food because they can't afford it, which makes them food insecure, which makes their health problems worse, which means they have to spend money on healthcare, but then they can't afford the food they need. People trapped in this loop of poverty, poor health, and hunger. And it happens year after year. The council saying there is often a perpetual cycle of income restriction, food insecurity, and adverse health outcomes, which is incredibly difficult to break. But there is a program in Detroit working to make food medicine and to help break that cycle of poor nutrition, poor health, and high costs.
When you're in the office and they say, well, to manage your diabetes, you need to eat these foods in this way. And then you realize that you want to manage your diabetes, you want to avoid the complications of, non-traumatic amputations, blindness, heart disease, all of those things that go with diabetes. And yet when you go home, you don't have access to the very things that your provider and your team within the healthcare setting told you about.
Dr. Kimberly Dawn Wisdom is with Henry Ford Hospitals in Detroit. She helps lead programs called Henry's Groceries that deliver food right to people's doors, and a program called Fresh Prescriptions, or Fresh RX, which helps put people on specific healthy food plans depending on their specific needs.
So what happens is when individuals go and meet with their doctor will say, okay, eat better. But oftentimes, as physicians, we're not trained on how you need to eat better for your particular condition. So this way, we don't have to have all that nutrition expertise. We actually can refer you to a community educator that we link the person with.
In 2015, the programs started with just a handful of people. Nearly a decade later, they've ballooned to help cover more than 1,300, which in a city like Detroit, where 50% of the residents are food insecure, it may not seem like a lot, but it is a start. And we know these programs really work. In a study in Preventative Medicine Reports that looked at the number from these programs in Detroit, took a look at levels of A1C, which measured blood sugar. Those levels have to be closely monitored for people with diabetes. The study found that just $10 a week for 2 months for fresh, healthy food helped lower blood sugar levels dramatically, while people who didn't get that money saw their levels rise.
So these programs work in a few key ways. The first is just getting people food. Programs like Fresh RX already do that right to their door. Also, making sure that that food is healthy, just like before, and also these are prescribed diets. In most cases, the food is healthy even when it's not. The last one is the most important one, education. So often people don't know how to prepare their new healthy food or don't know how to prepare it in a healthy way. These programs try to make sure that all three of these things happen so they can help alleviate some of those chronic issues.
It's not just about food. It's about food that is nutrition dense, that has the right calories, because all food is not the same.
In places all across the country, there are plans like Henry's Groceries and Fresh RX, and during the pandemic, they were invaluable, but they simply don't go far enough.
Okay, one more Venn diagram. It seems like this should be a thing that we can solve on a wider scale, but there are major hurdles standing in the way. The first is funding. So many of these programs are cobbled together by grants and donations, meaning sometimes that money can dry up or they have to meet strict standards. The second is insurance often doesn't cover these kinds of programs or these diets, only in cases that are really specific, like after weight loss surgeries or people with wasting conditions. Finally, it's follow-up from doctors. So often a doctor will prescribe a new diet or say you need to eat healthy, but then not be able to follow up with their patient, or that patient falls through the cracks, and tracking them down can be time-consuming and really expensive.
So even if Hippocrates didn't say food is medicine, he's definitely famous for something else, which makes this all come full, circle. The oath that doctors take, the Hippocratic Oath, is named after Hippocrates, and it says do no harm. And that's exactly what programs like Fresh RX and Henry's Groceries do. No harm, with the hopes of erasing this problem for good.
So what's your favorite kind of self-care? If you missed any part of today's show, check out Solutionaries on the new 6 Plus app for your smart TV. And that's where you can find all of our previous episodes, and there are some good ones, like this one about weight loss drugs. Do they work, and are they even safe?
When did you start talking about injections like Ozempic to help you lose weight?
I saw it on social media platforms like TikTok and stuff like that, but someone I grew up with, I think she was probably like the first person that I saw a huge change in.
It's been one of the best solutions that I've seen in 20 years.
So what are the side effects of using these drugs for weight loss?
Stomach side effects. So you'll see lots of nausea leading to vomiting, heartburn, acid reflux. So these medications are usually started at a very low dose to get your body used to it.
Or check out this one about your money and the solutions for protecting your life savings from bad actors.
You're taking your currency, you're putting it into the ATM machine, right? Mm-hmm. And then you're putting it in what they call a wallet. Once it's in the wallet, now the bad guys can access that money and move it offshore, and you're never going to see it again. And that's what the Secret Service is so upset about. Take a breath, step back, call your bank. I'm going to keep saying that over and over again because you're probably being set up. It's another con game to steal your money.
High-tech solutions for stopping shoplifters and finding pets. It's all free on News 6 Plus. I'm Louis Bolden. Thanks for watching.